Juan y a toda la misión comercial de Israel, porque, bueno, primero voy a hacer un anuncio antes de seguir adelante. Por favor, vamos a tener el evento tanto en español como en inglés. Por favor, en la parte inferior de sus pantallas van a encontrar la posibilidad de la traducción. Entonces, tienen obligatoriamente que escoger el idioma en el que quieren escuchar la presentación, porque o si no, les va a pasar lo que me pasó a mí hace un rato, que no escuchaba ni en inglés ni en español. Entonces, por favor, escojan el idioma de una vez en el cual ustedes quieren escuchar la presentación. Les comentaba, primero, muchísimas gracias, un agradecimiento muy especial a todo el equipo, a Sharon, Sami, Nir, a Amir, por acompañarlos, a Juan, por acompañarnos en esta presentación que vemos definitivamente tiene un matiz, unas características hacia adelante totalmente diferentes por los retos, primero, que nos ha impuesto la pandemia, y segundo, porque pensando también en la evolución que tienen nuestros sistemas de salud, definitivamente debemos dar un paso más allá y ver cómo nuestras entidades prestadoras, nuestras entidades aseguradoras tienen un comportamiento diferente, ya sea frente al paciente, ya sea frente a la tecnología, ya sea frente al resto de los eslabones de la cadena. Eh, cuando, cuando nos hacían las recomendaciones del, de la OECD, cuando Colombia estaba ingresando precisamente a la OECD, de los grandes puntos que salían a flote eran precisamente estos, era cómo teníamos que empezar a organizar nuestra información, cómo debíamos ser capaces de ver nuestras cifras de una forma diferente para poder hacer una alianza estratégica adecuada con nuestra contraparte, con nuestro asegurador, cómo podíamos mostrar unas cifras adecuadas desde nuestras instituciones al sistema de salud y cómo debíamos empezar a cambiar también nuestro modelo de atención, pensando en el gran reto que significa una cobertura universal. Cuando ustedes ven los análisis de los 90 del Banco Mundial, donde se empezaban a reflejar las grandes crisis, todos los informes de desarrollo humano de los años 90, en donde se empezó a mostrar cómo los sistemas de salud en un momento determinado iban a terminar colapsando las economías mundiales por los costos que implican, por los costos de la innovación, por los costos de la nueva tecnología y por el crecimiento desbordado de las enfermedades crónicas, de las enfermedades propias del desarrollo. Definitivamente los cambios de modelos llevaron a estas coberturas universales. Y estas coberturas universales, como lo que tenemos hoy en el país, en Colombia, plantean un reto también diferente. Ustedes saben que nosotros, tanto el equipo invitado como todos los asistentes a la conferencia, saben que tenemos un, un recurso financiero muy pequeño comparativamente con todos los países de la OECD y tenemos unos planes de salud, tenemos posiblemente el plan de salud más grande que uno pueda encontrar alrededor de todos los países. Eso plantea un reto muy distinto, eso plantea unas características, eso plantea que debemos enfrentarnos de una forma diferente ante la realidad de nuestro sistema de seguridad social en salud. Y por esa razón, en alianza con Israel, con todo el equipo, se ha planteado ver esas posibilidades, ya elementos que en este momento se desarrollan en Israel y que han dado muy buenos resultados, que ya nos permiten hacer interconexiones entre entidades totalmente diferentes, que nos permiten transmitir información hacia el sistema de salud de una forma diferente y que nos permiten como entidades prestadoras o aseguradoras anticiparnos a los hechos que vienen hacia adelante. Entonces, nuevamente un agradecimiento muy especial a todos por acompañarnos y confiamos también todas las entidades extraigan de estas presentaciones todo lo que esperamos precisamente sea de total satisfacción para las entidades de aquí en adelante. El reto es grande y por esa razón dentro de nuestro esquema, dentro de nuestro pilar grande como pilar estratégico de la Cámara Sectorial de Salud, de las cosas que hemos hablado es veamos herramientas de competitividad. Y hoy precisamente lo que vamos a ver con el equipo de Israel es eso, puras herramientas de competitividad para que nuestras entidades se enfrenten de una forma diferente al futuro. Bienvenidos todos, muchas gracias por su acompañamiento y Nir, te cedo la palabra. Muchas gracias.
Muchas gracias, Carlos. Buenos días. Es un gusto estar aquí con ustedes en esta mañana acá en Colombia. Es el primer webinar importante que hacemos en Colombia en el tema de salud digital y en salud en una manera práctica en general. Y es un gusto arrancar juntos de nuestros socios más cercanos en Andy. Y con nuestros socios más cercanos en Israel, Healthcare Israel, que van a hablar después de yo. El reto de salud en el mundo fue enfocado en el último año. Me parece que Israel tuve en mente mejorar el sistema de salud y preparar el sistema de salud a cualquier reto que hay en el mundo con la tecnología. Y cuando estoy escuchando a muchas personas acá en Colombia que me preguntan cómo Israel lo hizo, cómo se puede estar después, como en el día después del COVID, ahora, ya. No es solo con las vacunas. Lo que permite en un país regresar a normalidad también es conectado a las tecnologías, con las tecnologías informáticas, con el EMR, Electronic Medical Record, que Israel es el primer país que logró tener EMR completo a toda la población hace más de 20 años. Con la colaboración entre todo el sistema de salud israelí, que es un sistema de salud interconectada, interoperable. Y vamos a hablar un poco sobre también la tecnología que está de atrás de este esfuerzo grande que estamos haciendo en Israel hace 30 a 35 años hasta que lleguemos a este punto. Pero no es un trabajo de 30 años. Se puede mejorar el sistema de salud y se puede mejorar la salud y los servicios de salud ahora, ya. Y se puede hacerlo en una manera muy, muy práctica y muy rápida. Sí, es verdad que también en Israel hicimos inversiones grandes, pero la inversión más grande es en la tecnología y en los equipos. Y es el clave para lograr en este punto en nuestra realidad, pero también es algo optimista que podemos dejar y podemos usar en el futuro acá en Colombia como usan en todo el mundo. Las tecnologías israelíes de salud y las tecnologías israelíes de salud digital están en servicio al mundo. Y es lo que estamos haciendo y estamos ofreciendo a todo el mundo, nuestras experiencias, nuestro conocimiento, nuestra ruta, porque nosotros hicimos la ruta más larga y ahora estamos en el punto que podemos ofrecer al mundo nuestra experiencia y también todo el ecosistema de tecnologías que están desarrollando en Israel para el mundo. La inversión mundial en salud digital en Israel es un clave también. Las empresas israelíes que están innovando y están trabajando en salud digital no trabajan solo en Israel. Son empresas que trabajan en todo el mundo de su primer día. Nosotros, algunos de nuestras características, es nuestro Silicon Valley de Israel, trabaja con el mundo desde el primer día de trabajo. Y los startups israelíes desarrollaron también a empresas grandes con fondos grandes que están dedicadas a salud digital y mucho más. Nuestros socios de Healthcare Israel van a hablar un poco más sobre este tema. Lo que vamos a tener en este webinar hoy, vamos a tener, después de mi presentación corta, vamos a tener una presentación de mis socios de Healthcare Israel, Sharon Gouvalier y Amir Gilboa, que están ya con nosotros. Y después vamos a tener 4 empresas que son ejemplos, son empresas excelentes que van a presentar el tipo de solución que ellos ofrecen al mundo, pero son más como prototipos de soluciones que tenemos en Israel. La empresa primera que vamos a ver es una empresa que se llama Datos, que hace una solución de plataforma de salud digital, que es también tenemos acá con nosotros hoy EPS y tenemos hospitales y tenemos más entidades en el sector salud colombiano. Y lo que falta en muchas veces es una plataforma fuerte que se puede conectar todo y se puede hacer, permitir a los doctores que están en la clínica atender los pacientes de lejos. La segunda empresa que vamos a ver se llama IMD Soft. Es una empresa que tienen algunas soluciones, pero lo más importante es la infraestructura de Electronic Medical Record que ellos pueden ofrecer a hospitales, a organizaciones y a cualquier clínica que está en necesidad. También tienen soluciones para reorganizar los hospitales y reorganizar las organizaciones de salud en una manera digital e interconectada. La tercera empresa que vamos a ver hoy se llama TytoCare. TytoCare es una empresa ahora muy famosa en todo el mundo que tienen un dispositivo médico conectado que puede permitir diagnóstico remoto a todo el mundo. Es muy, muy popular ahora en Israel, casi cada familia lo tiene y ahora también en todo el mundo. Y la última empresa que vamos a ver en esta mañana se llama Vitalerter. Es una empresa que tiene una solución muy interesante también por el tema de COVID, pero en general de monitoreo continuo en la cama del paciente. Tenemos acá el Sami, el gerente de Vitalerter, que va a explicar después sobre su solución. Pero no es, todas las soluciones son muy, muy relevantes al este periodo y cómo hacer las inversiones en salud en una manera inteligente que va a quedar con Colombia por el día después y que va a quedar con los pacientes y el público colombiano en el día después. Esta crisis de salud es también una oportunidad muy importante y lo que queremos también ofrecer y es hacer los enlaces entre Colombia y Israel en el tema de salud mucho más estrechos y tener una relación y colaboración mucho más cercana. Y es también el objetivo de este webinar. Claro que estamos aquí para hacer todas las conexiones. Yo como el jefe de la misión económica de Israel en Colombia, con mi equipo que también estamos aquí, estamos muy pendientes y dispuestos para cualquier organización acá en Colombia, hospital, EPS o empresarios que quieren escuchar más y hacer el adelanto de una manera muy, muy práctica con las empresas que vamos a ver hoy o con otras empresas que ofrecen este tipo de tecnologías. Y estamos también muy, muy dispuestos para desarrollar una relación mucho más cercana con nuestros socios en Healthcare Israel que hacen este tipo de trabajo con muchos otros países en el mundo y estamos también pendientes para desarrollar este tipo de relación con Colombia. Voy a presentar solo este, este punto de contacto. Nosotros somos el punto de contacto para cualquier empresa que vamos a ver hoy o para cualquier relación. Voy también a escribir mi correo electrónico en el chat. Entonces, cualquier organización puede conectar con nosotros en una manera muy rápida y práctica. El último agradecimiento que quiero hacer es a nuestros socios en Andy, a Carlos y todo el equipo que están acá con nosotros en una manera conjunta para desarrollar el tema de salud digital y el tema de salud en general en Colombia. y que ven Israel como un socio importante, y muchas gracias para este espacio conjunto. Sin más palabras, voy a permitir a Sharon presentar, y Sharon va a presentar en inglés, entonces cualquier asistente que todavía no eligió español abajo puede elegir, pero elegir el icono de globo abajo, Interpretation, y elegir español. Muchas gracias, y estamos aquí también para preguntas más tarde. Si alguien tiene una pregunta por ahora, o por Sharon o Mir que van a presentar, puede escribir en el chat. Gracias.
Gracias, Niradam. Buenos días, mi nombre es Sharon. I will pass to English, please. I'll share my screen just 1 second, please. Great. So as I said, I'm very happy to be here today and present you Israel capabilities and the Ministry of Health digital health strategy. My name is Sharon Gouarier. I'm the International Account Manager on behalf of Healthcare Israel. With me today, Amir Gilboa, our Chief Digital Officer, who will present and go deep into the digital health platform we have here in Israel. Please feel free to stop anytime to write in the chat if you have any question. I'll be happy to answer them. I will start by a short presentation of the Israeli health system, very briefly, just to give the high-level picture about our organization, Healthcare Israel, and then dive deeper. We will dive deeper to the different digital health platforms we have here in Israel that we believe that can be very efficient and relevant to Colombia. So very quickly about the Israeli health system. First, you'll definitely find it much smaller than Colombia, but Israel has only 9.2 million population, and it's a relatively young population in Israel. As you can see, only 12% is age above 65. Israel has a very good public health system. It's a community-based system managed by 4 nonprofit HMOs, health fund. Patient can choose between each one of them, and can briefly move from one to another. And regardless of their medical or any type of other relative issues. In Israel, we have a national health insurance law. So each Israeli resident is entitled to health insurance, including a comprehensive basket of health services that is being updated every year. Regardless of gender, religion, age, location, each one of Israeli resident is in one of those 4. And we have to say that we're very proud to say, but the patient satisfaction rate is being monitored and published every year. And we can see a satisfaction rate average of 90% of this HMO. So we're very proud of our public health system. You can see here in this slide that Israel is ranking by international health measure if it's one of the highest life expectancy in the world. You can see it in relative of the OECD 2019 health report. High in child vaccination and low in infant mortality rates. So, and we're very proud to say that we were chosen to one of the number 5 in the world in the 2020 Bloomberg Health Efficiency Index, together with Singapore, Taiwan, South Korea, and Hong Kong. So, and as we can see, it's a very good public health system with a low cost per patient. So we believe those aspects is possible due to the digitalization. We will talk more later, but those results is a work of a lot of years, but it's the jump that we had been able to do. In this chart, you can see the percentage of GDP of healthcare expenditure for the almost 20 years. In all over the world, it's just increasing, and Israel managed to save it low and stable. So a lot, because it's a public health system, you would see it increase, but actually we are unable to keep it very efficient and with a low budget. And we are very proud, even more to say that we're number 1 in the world in vaccine, for we can see that in Israel right now we have 5.3 million Israeli that is already been vaccinated for the first dose. It's more than 50% of the population, and more than 5 million in the second dose. So we have a very, very high vaccine rate right now. We can see, Nir Adam said it, but it's coming back to life. Schools are being open, businesses are being open again. So we see the very valuable aspect and effects of the vaccine. Just very shortly before we will dive deeply, but I'll just have some number about how COVID hit Israel. So we have 9% infected in the start of pandemics, over 6,000 dead. Currently, right now, we had 3 waves. Right now, we had 3 waves and 3 lockdown, national lockdown. Different time each time, but that's what happened. Currently, we have severe cases, 350. At the peak, we had like 100,000 PCR tests daily. But as I said, for the tremendous success of the vaccine implementation here in Israel, now we can see a reducing in the restriction and opening of culture, businesses, and school. A bit about the vaccine current situation. We have 90% of the 15 age group are vaccinated. Also, we can see those numbers in people who have high risk. As I said, 5.3 are already vaccinated in Israel. There's a decrease in the our number here is beneath. It's changing every few days, but once you're opening the market, it changed, but it's kind of stable. And we can see a lot of reducing in the hospitalization. So we're very happy to see those results after a very hard year, as I can imagine. And putting COVID-19 aside, we have a lot of other very hard healthcare obstacle, and that's affecting all the world, all the countries. And one of them, it's unhealthy lifestyle, chronic disease, increasing of life expectancy, demand of health services. So we in Healthcare Israel, we believe that all of this bring us to the understanding that we really like this quote, that to treat 21st century problem with a 20th century approach to health would include impossible number of doctors. So, and that's what brings us to digital health. That's why it's one of our topics that we like to talk about it, because we believe this is the future and can help us tackle those health challenges that are arriving to all the world. So very shortly, we're Healthcare Israel. We were established by the Ministry of Health to promote a G2G cooperation, bring the knowledge from the government, from the health system, and the industry together. We believe we can bring the expertise, the innovation, the technology, and promote broad and long-standing relationship. And combining those 3 together to bring real value, because technology is not always enough. You need to, as a government, as a state, as a very big country, we need to know how to implement it and take the right step. So we believe it's a G2G, it's a win-win-win. You can bring integrative solution that bring policy, technology, expertise together alongside with experience of follow governments. We think this is priceless when we're talking between G2G project. You can bring all 3 of them together. So we see it as a very, very valuable solution. I'll just give 2 examples of projects we're working on, so you'll get a better understanding of what we're doing. So in the last year, we just signed an agreement with IDB Bank, I'm sure BID, as they call it in la country, which we will provide services of consulting and supporting for a digital health project in Latin America and Caribbean country on digital health. And it includes digital health training that we'll do virtually. We will start next month. If it's assessment need and Israeli expert coming to the country in different area, if it's HIE, big data, EMR, telemedicine, cybersecurity, we will bring the expert to do assessment need in the country and bring reports and do projects to actually help the countries with the knowledge we have here in Israel. So we believe we can, that's what we did with them. It's not a country, it's a financial institute, but we believe we can do a lot of good things together. And another example is a project we're doing with Sao Paulo, the state of Sao Paulo in Brazil, in which we'll provide the national HIE system, Israeli HIE system, national, is all connected here in Israel. So we are providing it to the state of Sao Paulo, together with the incentive and the regulation and the terminology and all the G envelope, we're calling it. So we can bring this partnership to the next level, not by just giving our national technology platform, but also the knowledge and experience we had implementing here in Israel. So very quickly, and I will pass Amir the mic so he can start talking about digital health, but in our vision is to export health system to do need assessment and expert consulting and training and project with countries, because we believe this is the added value we can bring for every country from our experience. And we will be happy to hear from you if you think this can be relevant. And Amir, the floor is yours.
Thank you, Sharon. I'll just share my screen. Can you see my screen?
Yes.
Great. So as Sharon told before, my name is Amir Gilboa and I am the Chief Digital Officer at Healthcare Israel. It's an honor for me to be with you today, and thank you for having me. The digital health in Israel is very, we have many of companies, some of them you will hear today after me, but just to get more understanding of our ecosystem. As you can see, the investment in percentage of the R&D here in Israel is very high in compared to other countries. And you can see the numbers of the digital health companies and from orthopedic medical devices and digital health company that increase over time. In Israel, we have, in the ecosystem, of course, we have the Ministry of Health that is responsible about the strategy, the processes, all the regulation. And beside, we have many companies in the private sector. And of course, we have another NGOs like the IAA that give funding to raise up these startups. And of course, we have the health organization that we have a great collaboration with to make pilot and to help to all the ecosystem to develop new product and to go forward. I wanted to talk about today a little bit about some very relevant platforms that we use here in Israel and the connection to the COVID and the influence between them. First of all, the electronic health record. This is the basic that collect the data from the patient. The HIE, the Health Information Exchange, a little bit about telemedicine that as we see all over the world, it was a very good effect and influence about in the last year. We talk a little bit about the hospital management platform and a little bit about systematic innovation. I want to start with the HIE. The HIE is aimed to connect all the data from the all organization. And here in Israel, we start to implement it about 7-8 years ago. And today, all the physicians say we cannot work without the HIE. It's a very effective on the treatment. We got a very quickly information about the patient, all the historical data, and then the physician can grant a very, very good and very efficient treatment. Here you can see the map of the network, the HAE network here in Israel. All the hospital is connection. We have here in Israel governmental hospitals. We have a Clalit hospital, and we have other hospitals, the private hospitals, and also we have connected the HMO. We have the 4 HMO here in Israel, and the IDF, the Israel Defense Force, also connected to this network.
Amir, I just want to comment that the HMOs are like the EPSs in Colombia. This is very similar, actually.
Great, thank you. So in the last year, we saw during the COVID, we saw the influence of this connection between all the organization. When we had to establish new department, new corner department, we have a very quick connection to all the data, all the clinical data for the patient. It was very easy to, in a very short time, to establish more and more COVID department. And as Sharon said in the beginning, we're very happy to say that we're now closing one by one all the department, and we hope we don't need him anymore. A little bit about the EMR. The EMR actually is the basic. We have about 25 to 30 years of electronic health record in our health system, in the HMO and also in the hospitals. So in each point of care, the nurses, the doctors can use and can record all the patient data, and of course to learn more about his historic data and the family data, and then after that we have all this data, we can bring it of course to the other organization by the HAE, and of course to research, to make big data researches and more and more. One of the projects the Ministry of Health established about 5 years ago, called the Clinical, is a lightweight EMR in the aim to establish it in a small or medium organization, that some of them work with papers and some of them had a very old clinical EMRs. This project is based on, it's a fully open source, it's a support and very international advanced standards called FIRE, and now it's available for other organizations that could implement it in all Israel. Another area is telemedicine that we have here in Israel, some kind of use cases. When we look at the point of view of the HMOs, we talk about doctor to patient. We use it for family medicine, for pediatric medicine, and also for pre-triage in the night or in the weekend. Of course, we saw when the COVID outbreak, we saw more and more use in this platform because we don't want the patient come to the hospitals. In the hospitals, we use it also to doctor to patient, but also to doctor. When we talk about doctor to patient, we use it for the team safety. We don't want the team to expose to the COVID patients. Of course, we have the ambulatory services. We don't want to stop it, but we don't want the patient come physically to the hospital. So we use telemedicine platforms, and we have after surgery or a procedure encounter, we can do it remotely. The doctor-to-doctor platform is, we use it for doctors from the periphery that want to consult with other doctors and they don't have them in the hospitals, so they can connect them by the telemedicine platforms. As you can see, this is some numbers of the increase in the encounters and the usage of the telemedicine during the COVID-19. I don't have to talk about more about it. We all understand the importance of these services. Last one, I want to talk a little bit about the hospital management platforms. We use it here in Israel. We work closely with the Directorate of Governmental Medical Centers, and we have some very interesting platforms that we use it all the time, but it very helps in the COVID outbreak in the last year. So first of all, we have Tatspit, that is centralized real-time BI solution that helps a manager to make a very good decision that based on data. We have a big data research platform. They use it to collect all the data and to get insight and to improve our treatment. We have Trigger Tool that is a very interesting tool that is responsible of risk management solution when we recognize some procedure that not appear in the right order or something that not correct. We get an alert and we can fix it and learn from that. Another platform called the Strategic Map that support of our performance management methodology and helps the hospitals to improve themselves and measure themselves and compare themselves to other hospitals in the network. Another platform called ELA, it is HR process platform that helps us, especially in the COVID, to recognize all the medical staff who is explored, who is in isolated, and to get real-time data to the manager that helps them to plan all the staff and which person to which department. And the last one called CoView, it's medical center controlling and monitoring that helped us to get all the information from all the COVID department and to get it in one view and helps the managers to get the right decisions. Here in Healthcare Israel, we believe that digital health technology is just part of the solution. When we want to make a good project, we have to take into account all the aspects around it in the start with the digital strategy, the security and privacy, the regulation, and also the architecture and the incentives to good implementation of the solution in the health organization. We offer a kind of services, start with the documentation and documents for a policy to case studies in digital health. We talk about in the beginning the workshop and training. We start doing and we do with the IDB Bank, mentoring, and the highlight is the digital technology and national platforms like the HAE. We talked about before. We believe that together we can learn from each other, drive innovation and efficiency forward, and in the end, bring prosperity to our people. So I believe we can do more together and deep dive our collaboration to make the world healthier. Thank you.
Thank you so much, Amir and Sharon. This was a very, very interesting presentation of what Healthcare Israel can provide to the world, and what Israel can provide to the world in the arena of health, and specifically how to digitalize and to make health systems more efficient, and to bring them to the front line of health systems, as Colombia is doing and is starting to implement on a larger and larger scale along the years. And also, as mentioned by Carlos in the beginning, also since the joining of Colombia to the OECD, the higher expectations and the higher expectations by Colombian citizens to get medical service that is on par with other countries which are in the same development level. So until now, we saw most of the solutions being implemented in Colombia in a smaller scale, and we'll be happy to facilitate a larger scale, a deeper collaboration between our countries in this sense, and to involve both government entities and organizations, health organizations, hospitals, and of course the private sector. Without further ado, if anybody has any further comment from our speakers, from Carlos, from Sharon. So
no, thank you very much for the opportunity, and hope to hear from you soon, and thank you.
Okay, thank you so much for your presentation, Sharon and Amir. As we don't have any questions for now, we will move to the first company that will be presenting today, which is Datos. We have with us the Datos team, and I would let Roy and Hillel take it from here. So please.
De todas formas, quería agradecerle antes de que hagamos la siguiente presentación, un agradecimiento a Mir y a Sharon por su presentación. Creo que hay muchas similitudes entre nuestros sistemas también y podemos ver que podemos trabajar hacia futuro. Mir, creo que en nuestras conversaciones habíamos hablado de este tema. Y debemos ver hacia adelante. Sharon, también te puse un mensajito allí a tu personal para que veamos precisamente hacia adelante cómo podemos interactuar en más temas. Amir, yo creo que hay muchos puntos de confluencia, muchos puntos de interés entre los dos países, y lo que les decía, esa similitud entre los dos modelos puede llevar a que actuemos más cosas, a que podamos trabajar más elementos en conjunto.
Okay,
muchas gracias por la presentación.
My name is Roy Elden, and I'm the Director of Business Development at Datos. Datos is a remote care automation platform and a telemedicine solution. Datos was founded, there we are, in 2015. We have over 50 full-time employees, and we're spread across the Israeli healthcare market, as you heard in the last presentation, highly digitized since the late 90s. One of our biggest customers is the Ministry of Health in Israel. And during the Corona crisis, we actually were rewarded a contract to track and monitor home hospitalization for Corona patients. Some of our other customers in Israel include the Sheba Medical Center, who's highly advanced. I think it's the 9th largest in the world. And all of their telemedicine, both in the Ministry of Health and in the Sheba Medical Center, all the telemedicine visits are running on the Datos platform. As I've seen in the slides, in a few slides that were shared before, it's over 130,000 visits just in the Ministry of Health account. So our platform is really a scalable solution for both small and large enterprises. Our platform basically is composed of 4 elements. On the patient side, we have the patient experience app. That's where the patient is basically manages their day-to-day activity. They're asked to input measurements or answer questionnaires, all according to the requirement of the care team. To that app, it is possible to integrate a device, a wearable device. It can be a simple device like an Apple Watch, a Garmin watch, or something more medical like a blood pressure cuff or glucometer. All that information gets routed to a management console, which basically can be logged in from any browser. And in that dashboard, basically, that's where the care team will handle the day-to-day of the patients. And also that's where you'll be able to create care pathways in a design studio that does not require any coding. It's all in the drag and drop environment. And that allows you to create multiple different care pathways, multiple different care plans to tackle really any medical situation, whether it will be diabetes and so on. We'll see that in a few more slides. So this is a screenshot of our platform. I've actually seen it in previous slides because we are, like I said, working very closely with the Ministry of Health. And just to give you an idea of what a typical deployment can look like, this is the Sheba Medical Center. And they started with a cardiology remote cardiac rehab program. And that expanded into virtual visits across all units of the hospitals, psychiatry home hospitalization, oncology symptom check. And they have more and more and more programs, as you can see, coming up. Other use cases that have been implemented on our platform includes some of the following. What you can see here, it's important to note that it is a cloud-based environment that's being set up to each one of our customers, meaning they have the access to their data. It's not our data, hence it's very secure. Some of the capabilities, but not limited to, yeah.
Jake, Roy, por favor, Roy, ¿estás haciendo presentación? No estamos viendo presentación o solamente nos...
I'm sorry.
Roy, sorry, the presentation isn't showing on the screen.
Oh, it's not?
Yeah, or if you can try again.
Try again.
From the beginning, it wasn't showing on the screen.
Okay,
Yeah,
perfecto, ahora sí.
Yeah.
Oh, so let me go back a few slides. That's a shame. So can you see it now?
Yes.
Everyone?
Yeah,
Okay.
we can see it perfectly.
Ahora sí.
Excellent. So really, it wasn't really much of information on the slides, just information about our customers and the way our platform is structured. Like I said, patient app, wearables, clinical dashboard, and care pathway design studio. Here are some screenshots of our platform. And that is actually very interesting. That is the use case in Sheba. And as you can see, the many programs that are currently running on their solution using the Datos platform. I will be able to send this presentation later on to whoever's interested. Other use cases that have been incorporated on our platform and are currently available to our different customers. And the effectiveness of working with Datos is really you have one remote care platform with telemedicine capabilities across all clinical domains. You have built-in data engine for cleansing and validation of that data. So for instance, if you're looking at the diabetes plan, before you take the reading, it will ask you whether you took the reading before lunch, after fasting, and so on. So that tags the data, which makes it more accurate. It's fully customizable, so it can work to any department and any role, and I'll get to the demo in a minute. The automation is built in, it doesn't require any coding. And with that, I'll move directly to the demo. Can you see my screen still?
Yes, we can. Yeah.
Okay.
Yes.
So this is our platform. As you can see, it's web-based. I'm able to log in from most browsers. I'm going to log in as a doctor, but in the same manner, I would log in in any role, whether it's a nurse, dietitian, whatever you think is suitable for a role. It can be also an admin. And based on that role, I can segment some of the information. I can decide that certain patients and certain information will only be exposed to certain roles or certain departments. This being a depot environment, we have basically mix and match of different programs that you can see here. But just in a nutshell, what you see here on the dashboard is an aggregated data from the patients, how many monitor patients we have, how many active patients we had over the last 28 days, how many pending follow-ups. The follow-ups can be shown here. These are all triggers, basically, that when setting up a plan, you decide what will be marked as urgent information or intermediate, and who would get that notification, whether it'll be a nurse, a doctor, the team. So just to give you an idea, if there is a deviation in the measurement, for instance, if a person measured their blood pressure and it's off by 10%, then that can trigger an alert to the nurse to look into that patient, follow up with that patient. But all that is done automatically. So right here, you can see the notifications, you can see the name of the patients, you can see the plan that are on, and information that coming from the wearables. It's drilled into one patient. So looking into a specific, this one doesn't really have a lot of data. Let's take someone more interesting. Here we are. So what we can see here is basically the historical data that are coming from the devices. We can break it down on whatever timeline we prefer. And drilling down into the modules, we can see, for instance, under blood pressure, additional information. We can change the alerts on a personal basis. So for instance, if I would like to trigger in Julius Miller's case to start at 168, and I can do that directly from here. We can also see that, for instance, this patient has blood pressure, glucose, weight, steps, and surveys activated on the plan. But this is something that, and in a minute when I'll show you how to create a plan, you can basically decide which building blocks are suited for this plan. So blood pressure, that's a model, that's a building block that can be associated with the plan. Then you can add another model in the form of surveys or steps or weight. And then when you mix and match those building blocks, basically allows you to create unlimited number of care pathways and care plans. Additional action that I can do from the patient's record is to launch an ad hoc survey, let's say a global health and well-being or something similar. I can start a video call directly with that patient. I can upload patients' measurements on their behalf, create a follow-up internal for a member of the care team, close a pending follow-up, or send a notification directly to the patient. So that's one way of setting up a telemedicine call, directly clicking here and initiating video intervention call. We have another way to do that with our virtual visits model, where we basically just input a number. And I'm going to use Nir's cell phone here because I have it. 313 4 5 5 0 3 5 10. So once I do that, Nir would receive a text message. This process does not require an app to be downloaded on the person's cell phone. They would receive a text message, and that text message will lead them basically to the browser of the cell phone, where they'll be able to log into a video intervention call with their doctor. Now we can also do schedule visits and add multiple different users on.
I can present this. Yeah, so I'm not sure if everybody can see, but I received this text message.
text message with the link to join the call.
With the link, yeah.
But you can do that. And so in cases, the Ministry of Health here in Israel uses this a lot. If they don't have patients, obviously, that downloaded the app because they're not under a certain program and they just want to have a video call with them, they just input the number, get on a call with them, and then later on they can decide what to do with that specific case. Let's build the plan. So like I said before, you can set up multiple different care pathways, multiple different care plans. Just gonna look into one existing plan, for instance, diabetes type 2 with high blood pressure. So we can see that the vital signs, the grayed out vital signs, those are the building blocks I mentioned earlier that are associated with this plan. If I would like to add one, I can just click and it's added to this plan. Once I choose those building blocks and I choose how I would like to receive my information, whether it's twice a week, once a day, manually inputted, through a connected device, all that is according to the choice of the health organization. Following that, you can start setting up the protocol, which is basically a mix and match environment where you choose one action and a correlating action. So if there's, for instance, if the glucose range hit the high one, the red area, then I would like a survey for high blood pressure to be sent to that patient. I would also like a notification to be sent to the nurse. So you can do all that just by dragging and creating a correlating action. A plan can have a few rules and could have multiple rules. It can start with a few rules and then you can add them as you see, as you learn more about what's the best way to operate such plans. It's all highly customizable. You can do it on your own. We're here obviously to assist you. But the idea is that with a few training session, you'll be able to do that on your own, or the health organization would have a professional who would be able to create such program. Same goes with the communication. Like I said, the communication alerts, just like NearGot, you can receive those as an SMS or push notification to the patient's app. It can be sent in an email to a doctor, and you can decide how you would like to configure that per alert, per patient, per program. It's really all up to the health organization. I'm going to touch a bit about the onboarding and some of the information. So this platform can be used as a standalone platform. However, we understand that health organizations have EMRs, EHRs. So integrations with those type of programs, with those type of softwares is available. We would have to scope it out. But for instance, if you would use this as a standalone platform, you do have the ability to onboard patients in a very detailed manner where you detail their past allergies, past surgical history, and so on. So that will be available to the care team when they treat those patients remotely. Happy to answer any questions about anything really.
Sí, Roy, hay una pregunta del público. Un momento. Pregunta Mónica Rincón del Hospital Pablo Tobón Uribe en Medellín. ¿Esta información que se ve en datos queda en la historia clínica del paciente?
If anyone can translate, please.
Oh.
You're on mute, Nir, if you're speaking.
Did you choose English, Roy?
Choose English where?
At the bottom, the globe.
The button. Oh, globe. There we are. English.
Sorry. So yeah, please repeat.
Yes.
Ok. Pregunta Mónica Rincón del Hospital Pablo Tobón Uribe en Medellín. ¿Esta información que se ve en datos queda en la historia clínica del paciente?
So all information, we set up a unique cloud environment for each of our customers. So if it's a hospital in Colombia, it will be in whatever local area, either on a Google Cloud or a Microsoft Azure Cloud. You will only, and the health organization will only have access to that information, to the health records. We will not have access to that, to the health record. The information will be saved and stored in the cloud according to the health organization requirements. If you decide to delete that, then it's deleted. If you decide to keep it and follow up with that patient, then that's also something that you can do.
Muy bien, otra pregunta de Carlos Montoya. ¿Podemos ver la interfaz de usuario? Para el control de enfermedades crónicas como hipertensión, ¿el usuario cómo ingresa los datos de seguimiento a la plataforma?
So you would like to see the patient's app? Let's see if I can make that happen. So on the other side of it is, like I said, there's a patient app. Let's see if I can display my screen, share my screen and show you the app. That app, by the way, can be white label and customized as your own. And I'll share my screen in a bit and you'll be able to see. Here we are, share screen. Can you see my screen now? Yes, verification. So this is the app. Like I said, it like you see, it tells you, it reminds you when you need to take, for instance, a glucose reading. So I'm going to do after breakfast in order to tag it. And in this program, for instance, I'm allowed to input the measurements manually. But you can also set it up where it will only come in an automated fashion through a wearable. Fine. The app also allows me to ask my care team for anything, basically send them a message. I can upload a file or take a picture, let's say of a wound or of medical history documents or blood test results. Then I can take up and I can upload a file. I can take readings according to the building blocks I have available, like I showed you earlier, whether it's blood pressure, glucose, or let's say saturation. And then all this information would go to the patient's record I showed you earlier in the dashboard. Does that answer your question?
Hay otra pregunta. Mientras Carlos responde, si quedó claro. ¿Datos permite interoperar con otros dispositivos biomédicos utilizando HL7?
Yes. Yes. We would have some devices, I'm sure we're already integrated, and others that we have not made an integration yet. We can definitely scope it out and add it to our list of connected devices. So if you have a device you're interested in working with, then we would gladly take a look at that and see if we can integrate that into the platform. Just to add to that, we have a list of over 60 connected devices currently.
Okay, I think we don't have any further questions for now. So I would thank Roy for his presentation. If you'd like, you can stay with us. So thank you so much, the team at Datos, Roy and Hillel. And we move on to the next company line. We have Shachar Bar Kochav from IMD Soft. Shachar, the floor is yours.
Hello, everyone. It's a pleasure to be here. If you can bear with me 1 second when I share the screen real quick. Let me know if you can see it. Can you see it?
Yes.
Okay, 1 second. Okay, so thank you all for coming here. This is an introduction to our company. I am Dsoft. We have been a player in the digital health market since 1996, right around the time the first EMR solutions started to make their way into the market. The founders of the company identified the space of critical care as an area that could benefit from digitization and the power of IT in terms of increased efficiency, accuracy, and productivity. Since 2016, Dsoft is owned by Harris Healthcare out of Canada, which is part of the $30 billion Constellation Group that is traded on the Toronto Stock Exchange. Our solution is called MetaVision. It's a suite of clinical information system software products that is designed to cover the whole range of clinical needs in the critical care space. The solution was designed with the scalability and global presence in mind around a single code base and supports digitization, customization for the specific needs that are often dictated by local markets. Currently, MetaVision enables clinicians to provide effective care to more than 2 million patients a year. It is implemented in literally every continent except for Antarctica and Africa. We're talking 24 countries from the US and Canada to Hong Kong, from the UK and all major EU countries to Australia. The system speaks 20 languages as of date, and it is deployed in 350 hospitals, give or take. I mentioned that we specialize in critical care, and what that means more concretely is that we have a very robust offering for intensive care units, operating rooms, but as you will see in a few slides, our solution has also been successfully implemented in hospital-wide and multi-site settings in several countries as well. Looking at the intensive care space, MetaVision ICU, which is the centerpiece of our solution, was designed by clinicians with their real-life use cases and workflows in mind. It really tries to bring together all the various data points that clinicians need to have before them when they treat a patient, anything from key parameters, lab results, alerts, all in a user-friendly and accessible way. Also, the system is a very configurable solution, which means that it can be made highly specific to the preferences of the clinicians, both physicians and nurses. Really anything from defining dedicated workflows and screens to creating specific alerts or putting together assessment forms or patient summary reports. We believe that, in essence, instead of teaching clinicians how to use the system, we teach the system how to work for the clinician and fit the clinician's preferences. Over the years, we took the capabilities of the main ICU solution, which I just described, and created very specialized implementations to answer the needs of niche populations, and more specifically, the neonatal population, the pediatric population. We put together a more precise drug and fluid management functionality in both of them. We integrated nomograms and also specific scores that are sometimes common in certain territories for those populations. To give you a quick taste of the system, what you see before you here is a typical screen of the system. At the very top, you can see the details of the patient, age, weight, allergies. Below, you have a ribbon that combines administrative functionalities like multi-patient views, dedicated doctor and nurse functionalities like insertion and approval of orders. And in the screen itself, you see both a numeric and graphic representation of the key clinical parameters and records of specific events, all in the specific timeline in which they occur. So it really gives the clinician the ability to kind of have a very well consolidated control and understanding of the patient's condition in any given time. Of course, they can go in and out of specific systems that interface with us, such as labs, microbiology, also the area of imaging, CT, MRIs, everything that goes into that. Beyond this, we allow, as part of the system, the clinician to see the entire journey of the system in a color-coded view, which is essential to support decisions on treatment based on a longer perspective rather than anecdotal data. So, for example, in this case here, we have Peter Sterling, who came into the ICU and spent 3 hours in the ICU. He was then transferred to the operating room, and afterwards discharged and went into a recovery in the post-anesthesia unit. Everything is managed by MetaVision and presented in a way that allows this continuous view of the patient, of patient's condition, without really requiring the doctor to sift through pages and pages of data or ask doctors from previous shifts. Everything is very documented at all time, which is very useful and convenient for the clinicians. Other than the ICU solutions that I mentioned, MetaVision is also implemented in operating rooms. The system provides the anesthesiologist, who is the customer in this case, the support that he or she needs to go through a surgery safely. That means that before we go into surgery, the system enables a streamlined pre-op assessment of the patient's unique situation as they are being prepped up for surgery. Then while in surgery, it allows the anesthesiologist to monitor the condition of the patient very, very closely by giving him direct access to hemodynamic parameters, to levels of medication and bodily fluids, the respiratory status, everything you need in order to keep the patient alive. And after surgery, while the patient is in recovery, the system really continues to assist the clinician in evaluating recovery and pain management. So overall, this is a very holistic and profound solution to these demanding clinical needs that are very typical in the case of the operating room. One thing further that I want to mention as part in the product section is as part of our effort to respond to the COVID-19 pandemic, IMDsoft worked with clinicians to figure out the best way to make all those well-established advantages of MetaVision accessible to clinicians on the front lines as quickly as possible. The result of this was MV Vital, which is basically a lean and to the point version of MetaVision that I showed before. It covers all the essential ICU workflows and has special emphasis on functionality that we know is highly relevant in the fight against COVID-19. What's more, MV Vital is very quick and easy to implement. In about 14 days, give or take, the system can be up and running and help certain hospitals leave pen and paper behind and become more efficient. We are very excited to be able to offer this to our customers, especially at times like this where you need to ramp up capabilities fast and do more with less. Of course, in support of implementing all the projects that I described, we developed over the years a very extensive library of more than 300 interfaces and drivers to allow for seamless integration with other systems in the hospital and the medical devices in the unit in which MetaVision is implemented. Of course, if needed, we happen not to have an off-the-shelf solution, we have the in-house development capabilities to bridge any such gap. To give you a bit more concrete feel for our customer base, you can see here several examples of prominent hospitals in the UK and in major EU countries that are relying on MetaVision. You can see the King's College Hospital in London, and of course, world-renowned hospitals such as USZ, University Hospital in Zurich, in Switzerland, La Pitié in Paris, and the München Clinic in Germany, just to name a few. We have also been selected as a vendor of choice for chains of hospitals and hospital frameworks, such as the Helios Hospital Group in Germany. They run 72 hospitals throughout the country, and currently we cover close to 700 beds across general and specialized hospital settings. The MetaVision Suite provides also the clinical IT infrastructure for regional healthcare systems. You can see here the example of the state of New South Wales in Australia, where we basically power all the ICUs across 25 hospitals, including in the capital of that state, which is Sydney, and the rest of the state at large. There is also an example in Europe with the Soros region in Norway, which has the most prestigious hospitals in the country, which also includes Oslo. In that particular case, we actually implemented a state-of-the-art solution that was made very specific to the needs of the hospital, and it is being continuously rolled out and built upon and developed further as a multi-year project. The use of the suite itself in the various settings that I described has translated into tangible benefits for clinicians in terms of increased productivity and overall efficiency, better financial performance and compliance with medical protocols. Really looking at it from a yearly perspective, they are able to quantify the gains, be it in terms of time saved per shift, increased revenue captured, or life saved thanks to better adherence to protocol. Over time, all those things really add up. So the fact that we have such well-respected hospitals which can quantify their gains in such a convincing way is a very nice testament that we are doing something right for those customers and of course for the patients. To complete the picture, I wanted to say a few words on our approach to development and deployment of the system. As I mentioned before, our solution is highly usable and configurable. So that has won us champions in the medical community, but we are also mindful of the fact that we are a business, and as such, the ease of deployment is a key parameter that ties directly to financial performance. In order to accommodate both aspects, we chose a layered approach to bringing our product to market. We basically start with a core offering that is global and contains the key innovations and practices that we gained in our close to 25 years in the business. Next, we had a layer of configuration that is only done once per market by a channel partner to capture certain requirements and practices that apply to the entire market and separate it from what you would call globally accepted standards. We leave this to our partners mainly because we believe that they are the ones that are best positioned to understand the requirements of their specific market, and they also have a better understanding of the regulatory environment and other parameters that are crucial to deploying a system like ours in their territories. After this, what is left is about 10% of implementation work, which is also done by our partner to fit the exact needs of the customer. This basically enables us to focus on what we do best, which is product development without sacrificing scalability or the need of the customer. I should add that we currently aim to work with channel partners 100%. In terms of types of partners, we have a diverse network that works with us, which brings together a nice mix. Some of these names like DXC, Every, and Mobigator you might recognize. Some are more geared towards services, others sell complementary hardware and software products, but they all share in common the core principle of our program, whereby the channel partners sell, implement, and provide first layer of support for MetaVision in their countries, while we drive the product development on a global level. We are constantly working to expand our network of channel partners and expand into new countries. So if any of you is interested in getting more details, please free to reach out to me. I would also be happy to share the presentation with you in case you find it relevant. So thank you very much for your time. I hope you found this presentation at least informative.
Thank you, Shachar. We have one question. Alejandra, if you can assist me.
Sí, tenemos una pregunta de Andrea del Carmen Liscano. En el pantallazo de visualización donde se encuentra la línea de tiempo, ¿es el resultado de la captura de información de la historia clínica por paciente?
Can you repeat that? I didn't turn on the translation.
En el pantallazo de visualización donde se encuentra la línea de tiempo, ¿es el resultado de la captura de información de la historia clínica por paciente?
Yes, each patient, the system allows the clinician to follow the progress of each patient in real time. This is not data that is captured in hindsight. This is a system that incorporates the data from all the medical devices and empowers the clinician to make decisions in real time. That's the strength of the system. Everything is done in a timeline.
Okay, thank you. So I think with no further questions, we'll thank you, Shachar, for this interesting presentation. And thank you for the entire IMDsoft team. And we move on to our third company for today. Each company that we're presenting today is working in a completely different vertical. The next company that we'll be presenting is TytoCare. And we have Mr. Manny Schickman with us. So Manny, the floor is yours. We cannot hear you yet. We can see the presentation, but cannot hear you.
Hi, thank you, Nir. So thank you everyone for taking the time, and thank you for the opportunity to present today. Today we're, as Nir mentioned, we're going to be talking about a company called TytoCare. I am the Vice President of Business Development here in our US office, and also responsible for our Latin American presence. So a little bit about our mission. TytoCare was founded in 2012 with the vision of transforming the way primary care is delivered. That vision was to shift as much care as possible from a traditional face-to-face encounter with a physician to the virtual realm. Obviously, that puts us in the telemedicine industry. As you probably know, now more than ever, services that can be virtualized are virtualized in a sense where physicians are overstretched, hospital systems are overstretched due to pandemic constraints, and obviously the patients themselves prefer, if they can, not to leave the safety of their home, and thus telemedicine as an industry, and Tyto in particular, is balancing the workloads and the preferences of patients during these challenging times. But with that said, the pandemic was obviously a key factor in the speeding up the adoption of telemedicine as a modality of care. But before the pandemic, and probably long after the pandemic, it will continue to grow as a means of providing care, effective care to patients. So TytoCare stands apart from traditional telemedicine, which is currently delivered primarily, if not exclusively, through phone calls, to some extent, chatting, as well as video calls. But as you know, and many of you are clinicians, what you can do over a physical exam would never be replaced by a video call. And a simple example I like to bring, I'm a proud parent of a 6-year-old. If he has a pink eye, sure, I can almost self-diagnose him. So yes, I will trust a video doctor to give me the prescription. But if my child wakes up with a cough and a fever, unless somebody can physically listen to his lungs and tell me that everything is okay, or maybe it's not okay, I will never trust a video doctor. So that's exactly where TytoCare plugs in. We essentially created a technology that can fully replace a physical encounter with a physician by providing a device that can sit either in a patient's home, and that's, by the way, our primary use case, or alternatively, we have a set of devices that can be put on the community level, whether those are community centers, schools, work sites, military bases, things of that sort, and essentially create many endpoints from which multiple patients can receive care. But the main focus around the technology is, as I mentioned, the ability to fully replicate an end-to-end encounter. But in this case, the physician can be 100 kilometers or 1,000 kilometers away. And the way we have done this is by creating both the hardware and the software component. On the hardware side, we have a device, and you see the home unit on the screen today, or on the slide. It has a base unit that has an exam camera in it. An exam camera can be used for any type of skin conditions, even post-operative wound care, things of that sort. The unit also has a built-in IR thermometer for temperature. And then through the different attachments, it can be converted to additional exam modalities. So the first one would be the attachment of a tongue depressor that allows an in-depth exam of the throat. We have an attachment of an otoscope that converts the device into a full-blown otoscope for an ear exam. And lastly, a stethoscope attachment that allows a heart, lung, as well as abdominal sounds exam. And recently, due to the demands of the pandemic, we also released a pulse oximeter allowing measuring the blood oxygen level of the patient. And so with this compendium of devices, we essentially replicate what a traditional urgent or primary care visit would look like with a physician. In addition to building a device, we build software capabilities that enable both point of care or consumer or patient usage of the technology, as well as clinicians consuming that data. And I'll show you in a second how that looks like. One of the biggest drivers for our adoption is the fact that we're not just a gadget, right? We're not just an Alexa that sits in your phone and can answer questions, but we're a true medical device approved here in the US by the FDA. We have CE mark and INVIMA. Just as an example, since we're talking to a Colombian audience, but overall we work in about 18 countries and have regulatory approvals in the countries we operate. And then the last piece that makes TytoCare modality a success is the quality of providers that we work with, right? So we're not just some sort of a doctor in the cloud. By the way, TytoCare is just a technology platform, and we do not bring our own physicians. We rely on the physicians of our customers that we work with, and those are primarily large hospitals that use our technology. And so the quality of the physicians providing services builds together what I like to call a puzzle of trust that creates that trust bridge between a patient at the home or a patient in a school to the physician, and allows a much deeper adoption of telemedicine as a modality of care, in addition to expanding the breadth of conditions that TytoCare can cover. We see TytoCare as a true household appliance, meaning that in some cases there are what's called remote patient monitoring devices and platforms. Those are traditionally prescribed to a single patient that has a chronic condition. So for example, CHF patient might receive a blood pressure cuff and a weight scale. When TytoCare is issued to a patient, we cover the entire household, not just the patient. So a patient can have a chronic condition. Maybe they have a spouse or a partner that might need to consume, maybe they have chronic swimmer's ear, such as myself. So somebody needs to look at my ear periodically and prescribe antibiotics. And the household can have kids that on average needs to see a doctor 10 times a year. So a lot of these in-person interactions can be now converted to virtual, and that translates into efficiencies, cost savings, of course, to the doctors, cost savings to the insurance companies, whether those are private insurers or governmental insurers, relieving the workload of physicians. And on the consumer side, of course, convenience and now safety, right? So if pre-pandemic, it was mostly around convenience, now convenience is also coupled with safety. Because if I'm a healthy patient, if I don't need to sit in a germ-infested waiting room with my child, I probably would avoid doing so. Or if I have some sort of a condition, let's say I'm an oncology patient or a dialysis patient, I'm immunocompromised, so I definitely don't need to venture outside. We do have, as I mentioned, several types of the solutions. One aspect that's called Tyto Home is designed to be present with the patient at the home or with the family at the home. And the main use cases are for primary care and urgent care for families with kids, elderly patients, monitoring of chronic conditions. We had, of course, due to the pandemic, a large coverage of hospitalization at home, so patients that were discharged from a hospital or avoiding hospitalization altogether with a light COVID condition that doesn't require ICU intervention, and those patients were hospitalized at home. And we, of course, work with governments here in the US, for example, on Medicaid and Medicare to take care of the most vulnerable of our population here. And then we have another suite of devices that we call professional devices that, and you see an example of what we call a Taito clinic here, which is essentially a kiosk. It's a turnkey solution. You can place it on any desk, whether it's a school, a community center, a rural clinic, an RB base, a police station, whatever that is, a senior care facility, and turn every single room essentially to a mini clinic. And we also have a backpack version if, for example, a nurse needs to visit a patient at the home, and so on. From a condition coverage perspective, most of these are self-explanatory due to the capabilities of the device that I explained. But again, typically most urgent primary care as well as chronic conditions can be diagnosed and monitored with the Taito solution. On the chronic side, particularly respiratory and cardiovascular conditions. Giving some examples of the capabilities. So, what we see in the Taito Clinic device, especially in countries in Latin America, but of course here in the US and Europe as well, the ability to stretch the reach of physicians, both inpatient, right? So not all the physicians can be in every hospital ward in any given moment. So these devices can be placed on the cart, for example, and wheeled from room to room in an inpatient facility in a hospital. Then it can go to ambulatory and outpatient facilities, create satellite access points, and then further reach into the community, again, whether it's work sites, schools, community centers, and so on. And then, of course, we have the home solution that gets us to the last mile, which can be with a patient at the home, and the patient can be either chronically ill or they can be a healthy family that just needs to consume services through virtual means. Just a quick overview of the Taito traction. So as I mentioned, we're in about 18 countries. We primarily work with hospitals. We have about 160 hospitals and insurance companies that we work with, and you can see some of the logos here. What I do want to emphasize, maybe to close the presentation, is just a quick overview of how the technology functions. So we work a lot, as I mentioned, in rural America and also in Latin America, providing access to care for patients who need it most. And so just for quick visuals, this is how a technology works from a physician perspective. So let's assume this is a physician view. She can be a patient at the home or in some sort of a worksite clinic or a rural clinic. And now a physician, whether it's a primary care physician or a specialist, can now do a full exam as if he was right there with her in the room. So this is an example of a heart exam with a stethoscope. So he can navigate on the points on her chest. He can record all of the data. He can apply different filters, much like you would on very high-end digital stethoscopes. This is how, for example, a throat exam would look like. So if she has some sort of a condition requiring a throat exam, again, typically done in any traditional urgent or primary care visit. And even though the focus and the lights are algorithmically controlled, the provider has full remote control over the device and can adjust, for example, the lights and the focus. And this is how an ear exam looks like. Again, this is from a provider side, right? So in parallel to seeing the patient in a video, which is what traditional telemedicine does, now the doctor has full exam capabilities and can actually provide true diagnostic data from the point of care. And then lastly, I want to show a quick example of how we work, and I'm going to finish here. This is an example from our work in rural Chile, and I'm going to just slide here. So here we have nurses from local municipalities going out with our Taito Clinic device to the most rural locations where patients sometimes wait for months, in some cases years, to see a primary care or a specialist doctor. And so these nurses are equipped with our device, are able to see 15 to 20 patients a day. And in this case, the doctors are located in Santiago. So essentially, they're expanding their reach to hundreds, in some cases, many hundreds of kilometers into rural Chile, providing effective quality and very cost-effective care to those who need it most. So we're very proud of these projects, and again, rural care and underserved communities is something that we see as a major part of our mission. So thank you again. Please, if you have any questions, happy to address.
Thank you so much, Manny, for this really interesting presentation. One question from my side. I think you mentioned, but I didn't get it. Did you already get the INVIMA approval?
So we are about a week and a half away from getting an approval. We work with a local distributor, and we're about a week and a half from getting the approval.
Okay, very good. So as I suggested also towards the other solutions we saw today, anyone interested can be in touch with me and I'll do the connections with pleasure. So I think there are no more questions in the chat. So thank you so much, Manny. I think the solution is very relevant for Colombia, both for the health organizations / hospitals and for families and households. So thank you so much. And now we will move to the last solution we will be seeing today, which is a company called Vitalerter. We have with us Sami El-Alouf, who will present the solution and its implementation worldwide. So Sami, the floor is yours, please.
Thank you, Nir. I'm very pleased to participate to this event. My name is Sami El-Alouf. I'm the VP Sales and Marketing of Vitalerter. I will start with just a few slides presenting the solution and the company. And feel free to ask questions if you have during the presentation. So a little bit short intro about Vitalerter. We have been founded 4 years ago with the intention to launch a product that will monitor beds very simply and save lives, of course. Mainly, we saw that in different healthcare organizations, the monitoring is done primarily manually with the nurses, or alternatively, also the monitor in emergency unit, for example. So the solution has been developed, launched 2 years ago, and we have now more than 5,000 beds monitored in all the world. We have received a seal of excellence from the European Commission, and we are deployed in different countries of the world, different areas like Europe, UK, China, and very soon we have started to be deployed in Panama with an hospital called Sector Salud. So I will show you a short clip in a few minutes. Before that, I would like to mention that the Ministry of Health has selected our solution to deploy, to connect beds in geriatrics clinics and nursing homes in Israel. And we are very pleased we have started the implementation with 2 pilots in Israel. Let me show you a short video of the Panama case. Hopefully you can hear the video.
En Pacífica Salud seguimos innovando. Pensando en la seguridad de nuestros pacientes, implementamos el sistema Vitalerter, una combinación de sensores de movimiento con inteligencia artificial.
El objetivo de este proyecto, que ya está implementado en nuestro hospital, es la reducción de la incidencia de úlceras de presión en los pacientes que no se movilizan y la reducción al mínimo de la posibilidad de caídas de los pacientes al bajarse de la cama.
El sensor inteligente de VitaLerter se instala en las camas y monitorea continuamente los movimientos, el ritmo cardíaco, la respiración y la calidad de sueño del paciente. La información es interpretada por los servidores y enviada a los celulares del personal médico y de enfermería, dispuestos siempre a garantizar la seguridad total del paciente. En Pacífica Salud, lo más valioso eres tú.
Okay, let me go back to the presentation. So the objective was, as you can hear in the presentation of the video clip, the objective was to reduce the number of falls and pressure ulcer. We have developed a mini sensor that you can see under the bed here that can collect basically all the movement from the bed, even the heartbeat and the respiration rate of the patient in bed without touching him. It looks like science fiction, but it works very well and very accurate. So the idea is to provide a simple way to send alerts when we see a deterioration, for example, of the heartbeat, or when the patient is going out of the bed, for example, during the night to go to the toilet and with the risk of fall, of course. So our solution is very simple to install. It needs only Wi-Fi inside the hospital. And there is no computer, everything is going to the cloud. It's a solution that provides 100% surveillance full time, 24 hours by 7. So it's like a virtual nurse that basically help the current care staff. So we see, of course, there is in ICUs, there is a very close monitoring from the nurse, but when you go to low care, for example, the care staff is limited, and the system is justified to provide alerts on time and at early stage, even at early stage, when to help the nurse and the care staff. So currently what we can do with our smart sensor, we can prevent falls, we can prevent also pressure ulcers. What we do is we check the movement of the body on the bed, and we can send a reminder alert to turn the body if the patient is not is too static on the bed, for instance. We can measure the rate, the heart rate, and then we can decide to put a threshold on the heartbeat and send alert as well. And we are developing also a smart bandage that will be able to provide also alerts on other vital signs like temperature and SpO2. So as I mentioned, the system is very well accepted in residence and nursing homes, also in geriatric clinics, and also we have recently adapted the solution for the COVID-19 applications. Because this system is installed under the bed, you can basically provide a remote monitoring to the nurse without entering the room of the patient. Here you have an example of a dashboard where you can see all the beds that are connected. And you see here the heartbeat. For example, you have an example of alert here when you can see the heartbeat, the respiration rate, the level of movement, and the level of relaxation or stress on the bed of the patient. We provide alerts, and also each nurse can report about the alert and report what she sees. For example, if someone is going out of the bed, the nurse will get an alert and then can comment on the alert when she arrives in the room. That's what I mentioned about the COVID-19 trials we are doing in Panama currently. So we have started deploying all over the world our solution, also in nursing home, but also in clinics and hospitals as well. The system is very cost effective and can be installed by the team, the hospital team, the IT team. You simply got the sensor and we give you a remote assistance to install it on each bed, under each bed. So if you have any question, I would be pleased to answer. Thank you. Nir?
Yeah, I think there are no further questions. Thank you so much, Sami, for presenting this wonderful solution, which is sensor plus software and much more. This is being used worldwide, and as we see, also first installations in Latin America. I will switch to Spanish now. Bueno, podemos cerrar este espacio. Gracias, Sami. Podemos cerrar este espacio. Espero que este webinar fue interesante para todos. Como mostré antes, todas las empresas que mostremos hoy son solo un ejemplo a lo que podemos ofrecer, pero cada una de las empresas que presentemos hoy es una empresa muy buena y recomendada de nuestro lado. Si alguien en la audiencia quiere estar con nosotros en contacto y conectar con cualquier empresa o solución que presentemos hoy, en cualquier pregunta, estamos aquí para hacer las conexiones. Y no menos importante es nuestro enlace entre Colombia e Israel en una manera más amplia. Carlos, por favor, si quiere decir algo antes que cerramos.
Perfecto. Nir, muchísimas gracias y a todos un especial agradecimiento nuevamente por estas presentaciones, a todos los equipos que nos presentaron, a todas las empresas que nos presentaron sus innovaciones, porque tengo la certeza y después de ver las preguntas que ustedes tuvieron durante las presentaciones, después de ver esas inquietudes, deja muchas puertas abiertas precisamente para que podamos entrar en interacción con ustedes. De modo que muchas gracias y a todos los asistentes. Tal como les dijo Nir, tenemos un puente establecido entre la misión comercial de Israel y entre nosotros como Cámara de Salud. Y nuestro principal objetivo es este. Tal como ustedes lo vieron, veamos qué se está desarrollando en otros lugares, veamos cómo estas entidades se han enfrentado a estos nuevos desafíos y traigamos ese tipo de tecnología precisamente para abordar esos desafíos que vienen de aquí en adelante para la implementación de nuestro sistema de seguridad social. Entonces, Nir, yo creo que serían esas solamente las palabras de despedida. Un agradecimiento muy especial a ustedes y a todo el equipo, a todos los que nos acompañaron durante la presentación, y creo que pues fundamental también haber conocido ese elemento de Healthcare Israel, en donde vemos esas similitudes también que tenemos como sistemas. Entonces, muchísimas gracias y espero sigamos en contacto para futuras ocasiones, ver en qué más podemos complementar.
Muchas gracias. Agradezco mucho a este espacio y a todos los asistentes. Muchísimas gracias y también a nuestro traductor. Muchas gracias, Jake.
Sí, gracias, Jake.